Each year, the international development community, including NGOs in the private sector, spend more than $200 billion on programs designed to lift people out of poverty and advance healthcare. These programs have helped countless people. But what if we could do even better? To fight poverty, you need to invest in infrastructure, physical health, education, and ways to make a living. That's where most aid programs focus. But now there is evidence that a resilient mind makes these programs even more effective. Resilience is the ability to adapt to adversity and overcome stress. It's a new area of mental health research with wide-reaching potential impact. Consider the brain. Under acute stress, the brain releases hormones and neurotransmitters that increase heart rate and mobilize energy stores. Make that stress chronic, and both brain and body undergo changes. We know from animal studies that stress targets the brain structures governing mood, motivation, fear response, decision-making, and learning. In those regions, branched dendritic neurons can retract, degenerate, or grow inappropriately. Amazingly, if you address chronic stress, a more resilient brain can bounce back to a normal state. So how do you alleviate stress? It turns out you can teach mental resilience.
Not only will it impact or improve their mental health, but it gives them the tools they need to advocate for their rights, to stay in school, and to improve their physical health.
That's Steve Leventhal, CEO of CorStone. His organization teaches resilience skills to youth living in poverty.
When we think about resilience, we think about internal assets like courage, determination, persistence, coping skills, and social assets like social emotional competence, communication skills, problem solving, conflict resolution. When a child has all these assets, they're better able to impact their environment in a positive way.
Over the past 2 decades, most resilience training programs focused on high-income countries.
CorStone was the first organization to apply resilience-based interventions and programs in developing countries.
Precisely where resilience training has the most impact.
In 2013, we launched a randomized control trial in Bihar. It's one of the poorest states in India. We conducted an intervention that included 3,500 adolescent girls in approximately 75 schools.
The girls were given lessons every week for half a year, either in adolescent health or resilience or both. The control group just went to school as usual.
Not only did we see impacts on resilience across the board, but in the arm that had integrated resilience and adolescent health training, we saw amplified impacts on health knowledge, attitudes, and behaviors. What this says to us is that resilience holds a lot of potential to amplify the results of traditional health training programs.
It could be the missing link in the fight against poverty and disease. So should the international community invest in mental health or more traditional aid programs?
You need both.
The UN recognized that need and added mental health as a development goal in 2013.
It's finding out that you have strengths inside of you that you can utilize to change the pathway of your life, to end multi-generational poverty. It's got tremendous potential. Every time I see that, it transforms me.
For Champions of Science, this is Seema Kumar.
A lot of people ask me, with all the difficulties that you encounter, why do you keep showing up? I guess the answer is I'm resilient.